Pour la 5e année consécutive, le forum Galien Afrique se déroule en terre sénégalaise du 6 au 9 décembre 2022. Le forum Galien Afrique offrira une plateforme d'échange exceptionnelle autour du thème « Accélérer la marche de l'Afrique vers la couverture sanitaire universelle ». Placé sous la présidence effective de son Excellence M. Macky Sall, Président de la République du Sénégal, le forum Galien Afrique réunira des experts scientifiques des secteurs de la santé, de l'économie, de l'environnement, d'éminentes personnalités politiques et de la société civile, d'anciens récipiendaires de prix Nobel, des universitaires et des centaines d'étudiants en médecine et pharmacie, ainsi que des jeunes innovateurs. Cette 5e édition du forum, avec 1500 participants, sera organisée en format présentiel et virtuel avec, du 6 au 9 décembre 2022, un forum des jeunes, un forum des femmes et un forum scientifique. Le vendredi 9 décembre 2022 se tiendra une cérémonie en présentiel au cours de laquelle, pour la seconde fois, le prix Galien Afrique, qui consacre la recherche, l'innovation, la santé et la technologie, sera décerné. Du 6 au 9 décembre, le forum Galien Afrique fait de Dakar la capitale africaine de la santé, de l'innovation et de la recherche.
Thank you so much. I'm very pleased to be your host today. My name is Rosebell Kagumire. I am from Uganda. I am a writer, an editor, and an activist. I'll be your moderator today. Welcome to this high-level roundtable on reproductive health in Africa by the Lancet Commission on the Future of Health and Economic Resilience in Africa. We are going to be looking at the state of universal access to sexual reproductive health services on the continent, and we'll be reflecting on the challenges, lessons learned, best practices, and approaches we can take away in this session. Without further ado, we would be hearing a few opening remarks from our host, Minister of State from Senegal, Honorable Awa COLL-SECK, who is also the co-chair of the FIRA Commission, the reason we're on this roundtable. I would like to welcome the Honorable Minister to give us a few remarks right now. Thank you.
Thank you. Bonjour tout le monde. Je voudrais en 3 minutes vous souhaiter la bienvenue à cette session extrêmement importante dans le cadre du Forum des femmes, qui est une session qui a trait à la santé reproductive. C'est un aspect extrêmement important pour les femmes et aussi beaucoup de challenges que nous avons pour régler ce problème de santé reproductive, surtout quand on parle des jeunes filles. Il s'agit d'une session dans le cadre donc, du Forum Galien Afrique, mais qui est vraiment parrainée par notre commission du Lancet, qui est une commission qui s'occupe justement de la dynamique des populations, mais également du problème de la santé de la reproduction. Et c'est pour ça que nous avons pensé, en tant que co-chair, puisque le chair est le docteur Pape, ancien ministre de la Santé du Nigeria, que tout le monde connaît, qui aujourd'hui est à Harvard, et qui m'a fait l'honneur d'ailleurs de me demander d'être co-chair d'un travail que nous voulons faire sur le futur de la santé et la résilience économique en Afrique. C'est dire donc que nous voyons très grand, nous voyons très large et nous allons vers le futur. Cette session est aussi co-parrainée par GFF, Global Financing Facility, qui est aussi un partenaire du Forum Galien Afrique et qui vraiment nous appuie beaucoup, nous accompagne Le travail qui a été fait dans les pays a été un travail que nous avons apprécié, que nous avons même commencé aussi avec le docteur Pape, et qui a abouti à ce que le président de la République du Sénégal soit coparrain de la campagne de mobilisation des ressources du GFF. Mais nous avons également CIF, qui est aussi un de nos partenaires concernant donc cette session. Nous vous verrez tour à tour, les gens parleront de beaucoup de choses, mais l'intérêt et ce qui est vraiment important pour nous, c'est que nous avons une approche multisectorielle, une approche pluridisciplinaire, car si on veut régler les problèmes de santé et surtout aussi prendre en compte les déterminants de la santé, notamment de la santé reproductive, il nous faut à coup sûr ne pas rester entre spécialistes de la santé, entre guillemets, mais ouvrir cela à tous ceux qui peuvent apporter une contribution. C'est pour ça que nous nous sommes ouverts aux Africains, mais également à toutes les institutions internationales. Et aussi, nous avons considéré qu'il fallait parler et impliquer la diaspora. Donc voilà ce que je voulais dire, juste vous souhaiter la bienvenue et vous dire qu'on voudrait que tout le monde, que ce ne soit pas un problème de Sénégalais qui se sentent chez eux, mais que tout le monde se sente vraiment à domicile, car le Sénégal est un pays où on aime les invités. Donc, s'il y a des erreurs dans tout ce qui sera fait, sachez que c'est de notre faute. On s'en excuse d'abord. Merci beaucoup.
Thank you so much, Honorable SEC, for those great remarks and for hosting us. We'd also like to thank His Excellency President Macky Sall for hosting the Galien Forum and this particular roundtable. And we would like to also set stage, we would listen to Pape Amadou GAYE, who is the founder and president, Baobab Institute for Health and Development. He's going to give us an opening keynote to further dive into today's theme. You're welcome, Mr. GAYE.
Thank you. Thank you so much for having me and for inviting me to give a few keynote remarks, which I apologize already. I was given 3 minutes. I'm actually requesting 5 to be able to go through the notes. And my name is Pape GAYE. I'm the founder of the Baobab Institute, which is a new organization we are setting up here in Senegal, mostly to continue our work as the CEO of IntraHealth International, which we did for a few years, focusing mostly on how to make localization a reality. But today, I will be speaking to you on behalf of SEMA, a new initiative which is actually being set up by some of the actors that were just mentioned, including the Bill and Melinda Gates and CIF, in collaboration with UNFPA and many around this room. I am honored to be part of this conversation, and SEMA recognizes the fundamental importance of access to sexual and reproductive health products and services for the future health and economic prosperity of Africa. Addressing this challenge will bring huge benefits at all levels, starting with the individual consumer, but also including households, communities, countries, and the continent as a whole. SEMA's approach is fully in line with that of the Lancet Commission. First, like the Commission, we recognize that the challenge of access is complex. It depends on the way that products are bought, sold, financed, manufactured, supplied, priced, regulated, and delivered. And it's not just a question of having the right conditions in place at the national level. There are also significant regional and global dimensions. Like the Commission, we are concerned about the heavy dependence on donor financing, which, as recent years have shown ever more clearly, is limited in scale and is fragile and volatile, with future prospects uncertain. Finally, like the Commission, we are concerned about the heavy, finally, like the Commission, SEMA has clearly recognizes the importance of the political dimension of access. You remember early this year in the United States, when the US faced a shortage of infant formula, President Biden invoked the Defense Production Act to give the government additional powers to address it. But there is no similar type of political response, either from governments in donor countries or African governments to the shortages of medicine experienced in clinics every day across the continent. SEMA was created in response to all of these realities. We need to move on from a situation in which funding is dependent on donors, in which market information is not available to countries, in which decisions on the products rather than the products to purchase and introduce are made in donor capitals rather than in response to the needs of African consumers. Our vision is a situation where the center of gravity of funding, procurement, and market stewardship shift to African countries themselves, underpinning by strong African national and regional institutions and policies, with global players supporting rather than dictating those efforts. To make progress, we need to find solutions at all levels, national, regional, and global. SEMA, the new initiative, has spent the last year assessing, together with partners, the strengths and weaknesses of markets at all levels and began to identify a set of priorities for action. We are currently undertaking those market assessments in 3 countries, Senegal, Burkina Faso, and 5 states in Nigeria. Let me give some examples of ideas that are emerging. First, we recognize that the inadequate and fragile financing is one of the root causes of insufficient access. We need to accelerate the pace of transition to national sources, both public and private. Our national assessment highlights that additional capacity building support to countries on sustainable financing framework and policies is a priority. We are considering ways to deliver it. Secondly, our assessment, without exception, all highlight the pressing need for stronger data and analytics across the public and private sector. Finally, we also believe that interventions to strengthen financing and data availability need to be accompanied by efforts to strengthen the tools and mechanisms of purchasing products. We see many instances where sexual and reproductive health markets are too small or fragile to be commercially viable to suppliers. That leads to gaps in supply and access. We have therefore been exploring the concept of an aggregator, a platform that could bundle supply volumes to make more markets commercially viable. We are keen to continue discussions with the Commission and other partners as this work continues. We are looking forward to learning from the discussion today and carry on the conversation in coming weeks. Lastly, I would like to call on this audience to pay specific attention to this area because we cannot start the process of empowering women and girls if we cannot deliver at least the products that they need to make that a reality. I thank you for your kind attention and wish you well for the session this afternoon. Thank you.
Thank you so much, Mr. Amadou GAYE, for those great remarks and setting stage for our next conversations. This afternoon, and indeed this event comes at a critical time when we have all passed through the last 2 years and a half of the pandemic, the COVID pandemic, and we are all aware of the devastation of the pandemic has left behind, socioeconomic devastation, but also the devastation on the lives of African girls and women in terms of health and particularly sexual reproductive health. I don't think there's any country in this continent we have not seen a spike in gender-based violence. We have seen many young girls dropping out of school because of pregnancy and sexual harassment, sexual violence that increased the last 3 years, that showed that our health systems were not delivering enough to protect women and girls in this continent. So this is a very particular time, and we are looking for not only urgent response, but sustainable response that can work for millions of girls and young women who urgently need it on this continent. So as we dive into this conversation, let's remember all these millions of people that depend on what actions we do and what we bring into this room today. It's very, very important, and I needed to emphasize the urgency of the matter that of the issue we are here. Joining me in our next panel will be we are looking at a very important issue of the critical governance policy and the regulatory challenges facing African countries and governments in achieving universal access to quality reproductive health services. We'll be listening from governments, donors, partners, civil society, and we'll be looking at some of these critical challenges and sharing lessons and what approaches we can put forward. And without further ado, I would like to invite our first panel of the day. Joining us in this panel will be Ms. Marian WENTWORTH, the President and CEO of Management Science for Health. You're welcome. You're welcome to take the stage. And next, joining us will be Ms. Argentine Matavel, Regional Director for UNFPA West and Central Africa. You're welcome, Ms. Matavel. And next will be Faustine Mukena, the CEO of Africa Resource Center. You're welcome, Mr. Mukena. Last but not least, I will be joined by Ms. Solange KONE, the President for Côte d'Ivoire Federation of Health NGOs. You're welcome, Ms. KONE. Thank you. Thank you. And we'll be listening shortly from Ms. WENTWORTH, and would like to hear from you, from your work. Can you share with us examples of governance, policy, and regulatory challenges that are faced by some of your partners on the region, in how your organization is working to address this kind of challenges together with the countries? You're welcome.
Thank you, Rosebell. I'd be delighted to. And honorable ministers, distinguished colleagues, and delegates, I'm really thrilled to be here. Thank you very much for the invitation. MSH has worked with ministries of health, with private sector and community-based organizations in Africa for about 50 years. And as your question reflects, access to quality sexual and reproductive health products requires very important investments, not only in the products themselves and the supply chains that support them, but also in sustainable financing, governance, regulatory systems that will ensure quality and safety, and availability through both public and private sector channels. And that's probably the theme of my remarks over the next couple of minutes. There are a lot of barriers to meeting these requirements. There are technical barriers, and the consequences of them we see when it takes a long time for innovations for postpartum hemorrhage to take a long time to diffuse through the system, for example. There are gaps in policies and recommendations, and my dear friend Pape, illustrated a couple of those in his remarks, and as well as regulatory, financial, and provider capacity. Obviously, we've heard a couple times already that financing is too donor dependent. And I think the solutions to shifting from donor dependence to nation and both public and private sector dependence means that we have to see structural changes really in how public sector and private sector and civil society work together. And solutions include things like local manufacturing, which may not be able to address the issue of cost up front. That's probably not the first win from local manufacturing, but will address some of the issues like inconsistent availability of products, which has a tremendous cost all on its own. One of the things that MSH has been working on for a number of years now is strengthening regulatory systems for regulating pharmaceuticals and medical supplies. When you have strong regulatory systems, you have a foundation for making it possible to develop local manufacturing capability. You also have a foundation for increasing the adoption of new products and innovations, regardless of where they come from. Now, countries can do this best when they do it in alignment with one another, and that's why MSH is working closely with the Africa Union New Partnership in Africa Development, and is also aligned to the African Medicines Agency. Private sector, when well regulated, can be another source of lowering costs, increasing innovation, and emphasizing quality. But we see a gap in donor and government attention to private sector capacity building at all levels, but in particular, business to business. In 2017, Management Sciences for Health founded a company in Kenya called MedSource. This is a private sector company founded under Kenyan law that focuses on allowing small pharmacies and health clinics to access pricing from the largest distributors for lower prices and quality assured medicines. It adds things like quality testing and so forth. But the reason it's a private sector innovation is because there is an extraordinary amount of inefficiency in the private sector there. And so there's a possibility of freeing up costs and making more available to more persons at scale across the organization. In some settings, the infrastructure we have to look at things like informal drug shops. 20 years ago, MSH actually worked with, under the support of Gates and a few others, to accredit drug shops and create a regulatory framework for bringing them into the healthcare system in Tanzania. It was a tremendous program that now has 13,000 running shops that is self-sufficient. MSH hasn't worked there for a number of years, but they still run on their own. There's a separate regulatory agency to look at them, and they pay for their own training and accreditation processes. That model has been moved to many other countries, including Liberia, Nigeria, Uganda, and Zambia. Procurement fragmentation. I worked for a manufacturer for a number of years, so I know the cost of this one. Procurement fragmentation actually makes it very, very difficult to see what underlying demand is. One of the things we want to actually really look at when it comes to commodities is what underlying demand is so that we can match supply to demand. When you put too much procurement disaggregation in the middle, fragmentation in the middle, then you put a lot of costs in the middle associated with either pooled inventory or other sources of inefficiency that also create risk. One of the things that MSH does frequently with governments actually is to help them understand their inventory and inventory positioning so that you don't get behaviors like just purchasing a lot of inventory when you happen to have cash to support it, so that you can see underlying demand and make decisions. An unintended consequence of that work is you also sometimes see errors in clinical decision making. So you end up advancing health in a number of different ways. And downstream supply chain logistics, getting things to the last mile, is one more place where I think we have to look at the regulatory frameworks, and we have to look at our structures and understand how to create more efficiencies. In Ukraine, Philippines, and Nigeria, we're working with local logistics providers that are under government support and control in order to deliver to the last mile. That kind of work is reducing costs. Okay. I'm in the last paragraph, so we're good. So one conclusion that I draw from all of this is that we need to start thinking about governments making an evolution from operators to stewards. They need to spend a lot more time figuring out how to govern, and we need to understand how to bring sectors together. And doing this will make a huge difference for women and girls, the folks that we care about most. Thank you so much.
Thank you, Mrs. Wentworth, for that excellent analysis in reminding us of the fundamentals, but also on what is working great in the issues that remain in this area. Now we'll turn to Ms. Matavel. You are going to share with us what is necessary to achieve universal access to SRH in your work and experience as working with UNFPA in the region of West Central Africa. You're welcome.
Thank you, Madam Moderator. What a million-dollar question, right? If we had figured that one out, we all would be home, right? It's a huge one, SRH, Sexual and Reproductive Health and Rights. And for the UN Population Fund, and we call ourselves also the UN Sexual and Reproductive Health, because that's central to the mandate we're given by member states. That's really what keeps us awake at night. And because when you speak sexual and reproductive health, some people get thrown off. They actually don't know where to start. And so at UNFPA, we decided to just crystallize it in 3 key objectives, and that is 0 maternal mortality, preventable maternal mortality, 0 unmet need for family planning, and 0 gender-based violence and harmful practices. And I'll stay at the harmful practices, family planning, and maternal mortality, because on the harmful practices, there's one that when we're doing now increasingly with governments investment cases, because we all know how governments have all these competing priorities, right? They need to put the road, they need to put the school, they need to put the health facility, but they also need to ensure that there's food. So with all those, and then security, increasingly, especially in this region, Western and Central Africa, security issues are increasingly occupying a lot of what's going on in the government's minds and how they allocate their budgets. And so under the harmful practices, we find that when we do the investment cases to see which sector or which intervention could have a multiplier effect in the development of countries, especially here in this region, we found that child marriage, stemming, reducing, or eliminating child marriage would have the highest multiplier effect, even more than, that's not very important, but we work on that, female genital mutilation or other investments, but that one single area would be. Now, what to do to achieve universal access to, the key challenges go back to the basics, the duty bearers versus the rights holders. We are faced in a region where the rights holders, those who actually have the rights to demand, do not have the information and the platforms to make their demands. And so, of course, I, as a duty bearer, can allocate my budget whichever way I want, because I'm the government. Because the rights holders do not have that information. And the civil society movement in this region is weaker. And so it's not surprising that, of course, the indicators in the West and Central Africa especially, but in Africa in general, have progressed ever so slowly. Almost no dent, no move, despite, even I'll talk for my own agency, UNFPA, despite 40, 50 years of being in a given country. Just last week, we were in Sierra Leone as UNFPA with 2 or 3 other partners to just do a deep dive and say, why is it that the indicators are not moving? And it was simple. I mean, sounds simple now after the deep dive. But on the one hand, you have governments providing what they believe they can provide, because no one is demanding. So they'll provide whatever they believe they can provide. And when you look at the structure of government spending or the sectoral spending, the health sector has heavily relied on development partners. And so governments have sort of said, oh, okay, so if our partners are going to spend there, we can spend in something else. So they haven't put hardly any funds. I mean, in absolute numbers, it sounds big, but in percentage of what they're spending, it's nowhere to be where it should be. Even, I'm not even talking about the 50% of Abuja. We're just, just any reasonable spending. And so what could be done? We on the one hand, you have the institutional supply side, but then the demand side has not been really, had the attention that it should have, because most development partners have tended, including UNFPA, to strengthen the facility. Because of course, for maternal mortality, the woman needs to be arriving and finding a facility that is ready, facility readiness. That's what we've been focusing on. But even there, how many midwives you train, they are on paper, they're all distributed to all areas, but then you find them all sitting in the urban areas. The primary health care has not benefited as much as the tertiary has. And so when you look, for example, in Sierra Leone, you have, I don't remember now, was it 63 or 83% of women who deliver in the facility. And yet, even if it's, let's say 63 to the lowest denominations, because I don't have the figure right now in mind, but it was very high. And yet you still have one of the highest, it's almost like it's like a crisis, an epidemic that should put the government to a standstill. If your rights holders could demand 717 per 100,000 maternal. When you compare to a country in the region, let's say Cabo Verde with 20, what does that tell us? So to say that we need to focus on the primary health care, we need to help communities be participants in the management of the health facility, at the primary health care, so that they can demand at that level the service that they deserve. The central government, as my previous speaker was saying, they should do more of a stewardship coordination. They should transfer the funds to that facility, and the facility will manage with the community and the facility. We have a case in Mali. Even with all the crisis in Mali, the maternal mortality remains relatively low when you compare to countries like Sierra Leone, for example, or Niger, because of that joint accountability. I'll stop here just because I see you. We could say much more. Thank you.
Thank you so much, Mme Matavel, for that deep dive into why it's very important to build demand and to build agency as we talk about sexual reproductive health services, that it's not enough to put an institution, but to build the right bearers to understand why they need that institution. Thank you. Next, we'll be hearing from Mr. Mukena, and we would like to hear your perspectives on what are the major technical financing, procurement, and supply chain barriers you have come across in your work, and what lessons should we take in order to achieve universal access to quality SRHR services? Thank you.
Thank you very much. Good afternoon. Bonjour à tous. When I heard this question, I thought, okay, there are so many experts on health on this stage and in this room that I thought, what am I going to talk about on sexual reproductive health? So I thought hard, and the organization that I'm representing here, and I'm privileged to do, Africa Resource Center, we are much more specialists in public health supply chain. So helping governments across the continent on putting together strategy about how to get medicine to the consumers. And I'm doing on purpose using the word consumers because I'm gonna tap into my 35 years plus of consumer product selling and distributing. So I thought, you know, sexual reproductive health, why is it that different from all the other essential medicine that governments, all the organizations need to get to patients that I call consumers? You know, it's all part of the strategy. So what is, and part of getting to the universal health care that everyone and every government is fighting and working hard for. So we looked at that and we thought the main issue, and Professor Guy touched about it, my distinguished colleagues here touched about it as well, is about that last mile. I'm calling it actually, why not to the door of the consumer? What is it that we have to do to make sure that the consumer, the patient, get the product at her door, you know, at his door? So, you know, how can we do that? So my organization supports government. We have offices here in Dakar, in Senegal, to look after West Africa, Côte d'Ivoire, Burkina Faso, Senegal, of course, and Togo. We have offices in Nairobi to support the East Africa part, to Ethiopia, Kenya, and we have offices in Cape Town, in South Africa, to support the southern part of Africa, Mozambique, Namibia, and South Africa. And what we do is to do high-level supply chain advisory to governments. And we do it with an open-minded, without any link, and we use government as our client, but not client as that they support us. We tend to find funds from the people who share the same passion as us, and to be, I'm not going to say independent, but at least to be free of the advice that we give governments. And the advice we give is not just giving advice and moving away, is working with the governments, ensuring that this is their priority, and developing together in the support of their capability, developing together the strategy, their policies, and how the roadmap on how they should be implementing this. So to give an example here in Senegal, we worked on how to get those products of sexual reproductive health to the last mile, but most importantly, to the consumer. And we had developed we call it a project that time, but it has been executed, that we call Yexina. And Yexina, for those who speak Wolof, it's I have arrived, I am there. So that's what we did, and that was successful in getting there. But the challenges are always there. The challenges are more about funding, and my colleague to my right has just mentioned it. You know, the government, it's about the Ministry of Health who need to make sure that to develop or to get the strategy implemented, they need to have budgets line that go and get into the national budget, so that they have, you know, something to support that before even we start talking about going around to see the donors and discuss. I think the donors will be more than happy, in my views, to support if the strategy is clear, if the policies are clear, and if there is a commitment from the government to have a budget on the table and say, okay, this is what is missing and how can we come in and support. So that's at least can be clear. So that has been one of these challenges that we would like to see the government improving on. The other part of it is that YECSINA, for it to work in Senegal, we needed to use logistics company that are local, that understand how to get to that door of those consumers, and government need to be open to understand that they cannot do their everything. It's not their core business to get or to start moving boxes. So if there are people, and we call them private sector, if there are organizations that are specialists in moving boxes, in getting goods to the door of the consumers, they should collaborate with those private sector, those companies to get those products. And we saw it worked in Senegal, and I'm giving an example of Senegal because we are here. The other challenge besides the founding is the procurement. And procurement, I'm not going to be saying anything new to you. We've seen it during COVID. During COVID, procurement has been difficult. Not one country can pull together and doesn't have enough muscles to be competing with some developed countries, and we saw it during COVID about getting vaccine. So we're thinking at Africa Resource Center about pool procurement, about local manufacturing, and all these, I'm not going to call them buzzwords, but all these good intentions have to be thought through. And the starting point for me and for Africa Resource Center is, what does the consumer want? How do we get those products to the consumer at an affordable price or affordable, and to get them visible and available all the time, which is not always the case. So in the pool procurement, it's all nice to think about, yeah, I'll have my local production, but what are the regulations and what could we get more by putting together a number of countries in a certain region, put their resources together and start working together, at the same time looking also at the regulatory barriers that can happen between the countries. If it's nice to put a plant in Senegal, but what is the purpose if the product cannot get to Burkina Faso because the regulation in Burkina Faso don't allow that to get there? So we at African Resource Center, we start engaging with regional economic bodies. So we're engaging with the like of WAU, we're engaging with COMESA, we're engaging with ECOWAS, and we are even talking to African Union as they develop African medical agencies to see how the member states can start tapping into that, and we can organize pool procurement that makes sense. We can organize local production that makes sense, having the consumer in mind and having the whole chain of all the barriers that can be on the way to get there. So these were my thoughts that I would like to share with you. Thank you.
The question was a mouthful, so we excused a little bit more minutes exceeded, but you have been able to tell us what the kind of work you do, what does it look like to give advice that works, right? But also the issues within the supply chains, and reminding us to make local linkages, because what works in one place does not work in the other. So thank you very much for bringing those points out. We are going now to our last speaker. We would say last but not least, certainly. And we know Ms. Matavel has already touched a little bit on the role of civil society and the place of civil society in this issue. So we would like to hear from Mrs. Kone about why civil society and community understanding of sexual and reproductive health policy frameworks is really important in achieving universal access. Thank you.
Merci beaucoup. Je
vais vous permettre pour les personnes qui ne parlent pas français de prendre les écouteurs. Et donc, merci encore, j'espère qu'on y est. Nous avons cet après-midi un sujet qui est un sujet délicat pour l'Afrique, la question de la santé reproductive. Ce que nous savons, il est de notoriété que certains sujets sont des sujets tabous. Faire de l'éducation pour amener les personnes à adopter une contraception ou bien à observer des mesures n'est pas chose facile. Et c'est ce que la société civile essaye de faire auprès des communautés. Il y a donc cette barrière, il y a donc ce blocage qui est dû au fait des croyances culturelles, des croyances habituelles que nous avons. Mais de l'autre côté, en face, du point de vue gouvernement, la question n'est pas non plus facile. Il y a, si je vous prends par exemple le cas de la COVID, lorsque l'épidémie est arrivée, les premiers services qui ont été suspendus, un des premiers services, ça a été les services de la santé de la reproduction. Parce que c'est des situations, on pense par exemple que les services de la reproduction sont des services qui sont facultatifs et qu'il ne s'agit pas de quelque chose, d'une maladie ou bien de l'atteinte à la santé. Ça rejoint certainement la croyance qui est habituelle au sein de la communauté. Donc, de ce fait, on rencontre beaucoup de difficultés. Les personnes utilisatrices de ces services-là rencontrent beaucoup de difficultés. Nous avons fait une étude en son temps et dans la communauté, ce qui nous a été rapporté, les données, je ne les ai pas ici, mais c'était quelque chose d'assez alarmant. Une personne avant moi a dit, qu'est-ce qui bloque? Et je crois que c'est justement cette question que nous devons nous poser à tous les niveaux. Qu'est-ce qui bloque? Même celui qui m'a, l'interlocuteur avant moi, ce qu'il dit, on sent très bien les questions de blocage à l'intérieur. Donc, qu'est-ce qui bloque? Pourquoi on ne peut pas apporter les services au dernier kilomètre? Pourquoi est-ce qu'on ne peut pas rendre public ce qui est normal? Et donc, il faut peut-être aller chercher plus loin pour voir quels sont comment on appelle, qu'est-ce qu'il y a comme obligation qui pourrait être de la part, par exemple, de nos gouvernants à apporter ces services-là. Si mes souvenirs sont bons, je ne vois pas encore de textes de loi qui font obligation, par exemple, aux services de santé à offrir ces services-là. C'est des services qui, comme je l'ai déjà dit, sont comme si c'était un apport facultatif qu'on faisait aux intéressés. Et pourtant, les conséquences du fait du non-respect de ces services, du fait de la non-disponibilité de ces services, nous tous ici, on les connaît. On les connaît parce que la mortalité maternelle, la mortalité infantile, la situation de niveau de vie, tout ça, on le sait. Et pourtant, on ferme encore les yeux sur l'importance de ces services-là. Pour aller un peu plus loin et arriver peut-être à ce qui pourrait être, comment on va dire, une des portes de sortie, une des portes d'avancement sur ces questions, prenons la question de la CMU qui a été introduite dans nos pays. La CMU, lorsqu'elle a été introduite en Côte d'Ivoire, nous, on avait pensé qu'elle allait prendre en compte certains services qui n'étaient pas jusque-là offerts. Et ces services seraient peut-être facilités de ce fait-là. Mais qu'est-ce qu'on a constaté? On a constaté que ça a été globalisé. On a plutôt arrimé la CMU à des assurances qui étaient déjà existantes. Et même la question des indigents que nous avons posée en se disant que certaines catégories de personnes ne peuvent pas avoir accès à certains services parce que ce n'est pas pris en charge. Ces services, la question de l'indigence a été aussi traitée, on va dire, pas avec beaucoup, j'allais dire, pas véritablement comme il se devait. La société civile n'a pas vu de quelle manière les indigents ont été sélectionnés. La société civile n'a pas vu pourquoi, par exemple, la CMU n'a pas adressé, n'a pas ouvert ses services à certaines catégories de personnes. Donc, je prends ces exemples pour vous dire que jusque-là, la question de la planification familiale, la question de l'accès aux produits contraceptifs, la question de comment on sécurise nos mamans, comment on sécurise nos filles, n'est pas encore à l'ordre du jour. Au niveau de la société civile, nous avons constitué des réseaux. En travaillant en réseau, on essaye de faire du plaidoyer. Plaidoyer pour que les financements, justement, soient adaptés aux services de santé. Malheureusement, à ce jour, ce n'est pas encore tout à fait le cas. Je vais, par exemple, à ces propos, vous prendre l'exemple de la Côte d'Ivoire où il y a eu le dialogue national en 2019. Le dialogue national a ressorti les manquements, les déficits, les insuffisances qu'il y avait sur le système de santé. Ensuite, il a été mis en place une plateforme pour adapter le financement aux besoins des communautés. Malheureusement, de 2019 à ce jour, aucune recommandation n'a été appliquée. Aucune action n'est venue démontrer qu'on a vraiment envie de faire des changements. Et donc, pour nous, il est bon que, en tant qu'acteurs, j'allais dire l'ensemble des acteurs, comme l'ont déjà dit mes prédécesseurs, nous devons nous donner la main. La société civile est là pour aller jusqu'au dernier kilomètre, pour aller jusque dans les communautés, pour non seulement faire l'éducation, mais également aussi apporter, j'allais dire, leur apporter ce qu'il faudra pour que la communauté comprenne que ces services ne sont pas des services aléatoires, ce ne sont pas des services facultatifs, mais que c'est des services qui ont leur grande importance aussi et qu'on puisse ensemble demander leur application à travers des textes de loi, à travers tout ce qui peut donner de la durabilité à ces systèmes-là. Donc, voilà, merci beaucoup. Et merci pour...
Thank you so much for that great analysis on the challenges the civil society face, the legal frameworks that are not really supportive, often in the underlying inequalities and discriminatory nature of what drives the inaction to give women and girls the services that they need, and reminding us that we need to take this seriously. Thank you so much, Mrs. Kone. And I want to thank all our speakers and give you one minute to share one takeaway in case other speakers were talking and you thought something that you need to come back and share with us. Just 1 minute. Thank you.
I assume you're going in the same order. Yes, okay. Oh gosh, there's not a lot I can say in 1 minute, but I will say what I've said before. We need to work together, all sectors. There's a lot that needs to structurally change in order for us to make a difference. And that is from civil society, that's in private sector, and at the center of that is actually governments. So I think we are aligned in terms of our goals, but we're not aligned in the how, and that takes a roadmap and a lot of sweat and hard work. Thank you.
Thank you. I'd say that at the root of all this lies the issue of really understanding the centrality of the adolescent girl, the centrality of women's health with the rest of the goals that any society has. As long as we're not investing in that girl from when she's young throughout her adulthood, we're not getting anywhere. We're dancing around the forest and the tree, but we are missing that link, the seed, the root cause. Thank you.
Let's work together. I will say, like my colleagues, let's put together our minds. Let's put together the strategy and priorities, align on them, and agree that every expert will do his share so that we can all get the result that we are looking for. Thank you.
Merci beaucoup. Je parlerai de volonté politique en termes d'équité en santé. Que les gouvernements comprennent que ce n'est pas facultatif, ce n'est pas vraiment des services qui sont des services sans valeur, entre guillemets, mais c'est des services, on va dire, qui ont autant de place que tous les autres. Donc, que la volonté politique soit une réalité.
Ms. Matavel, thank you, Mr. Mukena. Thank you, Ms. Kone. We have been really enriched by your knowledge, and we will hope to catch you in the next conversation at the end. So thank you so much. We'll be bringing forth a new panel. Thank you. You can now take your seats. A round of applause. Thank you. Now, as you can imagine, have you already seen the program? We are on a marathon. Yeah. Are you ready? Are we still awake? I hope so, because we have our next speakers and 6 of them. So we will be hearing our next speakers, and each of them will have 3 minutes. 3 minutes, quite tight, but you can make it. So our next speakers will be looking at the current asymmetries in power, resources, and legitimacy, and the role of stakeholders and partnerships in achieving universal access to quality sexual reproductive health services. So joining me in this conversation will be Dr. Dabire Estelle Edith Ndembere, the General Secretary of the Ministry of Health and Public Hygiene from Burkina Faso. Put our hands together for Dr. Ndembere. Joining us will also be Raven Chaudhry, who is the Interim Director for SRHR Health Systems at the Children's Investment Fund Foundation. You're welcome, Ms. Chaudhry. Also joining us on this panel will be Ms. Christina Chilemba from Malawi, who is the GFA Youth Representative. You are welcome, Ms. Chilemba. Next will be Mr. Brendan Hayes, who is a Senior Health Specialist at the GFA Secretariat. Welcome, Mr. Hayes. Also joining us will be Ms. Myro Mandara, who is the Special Advisor and Coordinator, Sustainable Development, Partnerships, and Humanitarian Support to the Executive Governor of Borno State, all the way from Nigeria. Join us, please. Where is our speaker? Okay. I think she's going to be joining us along the way. Last but not least, we'll be joined by Ms. Sanu Nying, who is the Regional Director for West Africa at Maristops International. You're welcome, Ms. Nying. Great. As Ms. Nying takes her seat, this is going to be a very exciting panel. And looking at all the issues we are looking at: resources, power, legitimacy, all the issues that we face every day in our work as we try to deliver services, whether you're in policy or whether you're delivering the actual services. So I would like to start with Dr. Ndembere and Mrs. Chaudhry. would like to hear your perspectives on how asymmetries in power show up in this subsector, and how do they play out within resource mobilizations, and how the questions of legitimacy can be addressed. Because for you to actually effect change, you must be believable. People must see you as, as doing the good for them. So the search for legitimacy is always at the heart of any of the work we are doing. You're welcome. Dr. Dembele, please take the microphone. Thank you.
Merci, Madame. Bonsoir, chers tous. Donc, je tiens à remercier la commission du Lancet sur l'avenir de la santé et la résilience économique en Afrique, ainsi que le GFF et la fondation du fonds d'investissement, le CIF, pour avoir organisé cet événement. Je m'excuse, mon anglais n'est pas très bon, donc je préfère aller en français pour ceux qui connaissent nos amis anglophones. Donc, je suis du Burkina Faso. Je vais parler de notre combat au niveau du gouvernement en tant que secrétaire général du ministère de la Santé. Nous savons qu'il n'a jamais été aussi important de veiller à ce que toutes les femmes et les jeunes filles aient accès à la santé sexuelle et reproductive. Le monde est confronté à de multiples crises, nous le savons, il y a la COVID, il y a les guerres, il y a les attaques terroristes, notamment dans nos pays africains de plus en plus. Et donc, les femmes sont confrontées à des difficultés, de véritables obstacles pour accéder aux services de santé sexuelle et de la reproduction. Et nous savons donc que cela les expose à des risques élevés de grossesse non désirée et réduit fortement, bien sûr, leur possibilité de mener une vie saine et productive. Et donc, je suis vraiment honorée de pouvoir participer à cette discussion pour voir comment, ensemble, on peut arriver à équilibrer les asymétries dans le secteur de la santé et construire des systèmes de santé plus équitables qui peuvent fournir des services à toutes les femmes, à toutes les filles, dans le cadre de la santé, de la reproduction, des droits sexuels et reproductifs. Le Burkina Faso s'est engagé à atteindre la couverture sanitaire universelle, à fournir notamment des services de santé, droits sexuels et reproductifs abordables à toutes les femmes, à toutes les jeunes filles. Nous avons pu mettre en place des services de gratuité de la planification familiale et dans le cadre de nos efforts pour élargir l'accès aux services, y compris bien sûr la santé sexuelle, nous avons créé un programme spécifique et nous avons lancé un programme de réforme pour renforcer la santé communautaire avec des investissements importants dans les infrastructures de santé communautaire. Il s'agit notamment d'investir dans la formation des agents de santé communautaire qui sont aux côtés des agents de santé qualifiés, formés de façon classique, mais que nous utilisons de plus en plus pour offrir des services dans les endroits les plus reculés du pays. Et donc, en matière de planification familiale, en matière de santé génésique, beaucoup d'efforts sont faits et nous avons activé aussi la numérisation des prestations de services de santé communautaire qui constitue un de nos gros chantiers pour éliminer les obstacles difficiles à atteindre. En 2021, nous avons fait une petite évaluation et cela a montré que les régions qui présentent les taux de prévalence contraceptive les plus élevés sont celles qui ont un taux élevé d'agents de santé communautaire par rapport aux autres régions. Et cela montre que c'est une stratégie qui paye et avec les crises actuelles, nous avons de plus en plus d'engouement à relever la santé communautaire comme stratégie. Nous savons que le succès de nos actions dépend de facteurs multiples. Et donc, bien sûr, il faut fixer les priorités et aligner les partenaires et les ressources sur ces priorités. Nous devons rallier le système, les soutiens et nous engager auprès de multiples parties prenantes pour compenser les lacunes du système. Tout au long du processus, donc, c'est toute cette activité pour augmenter les chances les droits sexuels et reproductifs. Nous avons vu que nous devons avoir une vision, une feuille de route. Le GFF et d'autres partenaires nous ont appuyés. Nous avons élaboré un plan, un dossier d'investissement, un plan de développement sanitaire avec comme priorité la santé sexuelle et reproductive, la santé de la mère et de l'enfant, SRMNIA. Dans le cadre d'un dialogue continu avec les donneurs, nous avons fait un gros rassemblement des donneurs au niveau du pays et au niveau des donneurs internationaux qui travaillent avec nous, avec la société civile, avec le secteur privé qui de plus en plus s'engage à nos côtés dans nos différents chantiers. Et nous avons compris aussi que nous devons avoir des outils adaptés et surtout des données, et il faut les produire, il faut trouver les bonnes données pour prendre les bonnes décisions. Donc, nous avons aussi trouvé comment avoir la cartographie de nos dépenses et nous savons maintenant où sont nos ressources, comment elles sont dépensées, quels sont les gaps de financement. Et c'est un processus que nous allons continuer à travers nos différentes plateformes de travail. Nous insistons sur l'engagement des jeunes, de la société civile, des femmes dans nos activités et nous savons que c'est eux les véritables champions dans le changement que nous voulons aborder. Voilà, merci pour ce panel que nous animons ensemble.
So much, Dr. Dembele. And for those words, you touched a lot on different ways Burkina Faso is addressing this issue, digitization and the place of data. It's very, very important. And also no need to apologize for not speaking English. We are all improvising the colonial language, you know. Thank you. Next, we should hear from Mrs. Chaudhry, who's going to also still on the same question of asymmetries in power and how they can be addressed in the questions of legitimacy. You're welcome.
Thank you. Bonjour tous, exactly opposite from the first speaker. I'm going to speak in English because my French is not so good. So thank you so much for the introduction, and I'm delighted to be part of this panel representing the Children Investment Fund Foundation. Now, whilst we're here to deliberate on what needs to change to redress the balance, it's important to recognize the significant progress that has been made over the last 2 decades. So I want to start by recognizing the significant contributions made by programs like UNFPA Supplies and FP 2020, now FP 2030. As to your question on how asymmetries in power show up in the sector. As pointed out in the previous panel, SRH access is disproportionately dependent on donor funding. With changing political priorities in donor countries and the burdens of multiple crises, such as the COVID pandemic and the war in Ukraine, the prospects for donor funding over the next decade remain uncertain. So how do power asymmetries manifest themselves in the sector? 2019 RHSC estimates showed a global annual commodity gap of $111 million. This could increase as much as 5-fold between now and 2030. And this is occurring at the time when the largest generation of young people in Africa are entering their reproductive years. In most LMICs, 70% or more of the national commodity needs are donor funded. Furthermore, 78% of donor spend comes from just 3 donors, leaving the system vulnerable to shocks.
The decision of the UK government to significantly cut its funding to family planning in 2021 illustrated this very clearly. We continue to see the negative effects of this decision across Africa. So CIF is very clear that the only route to sustainable, resilient, and equitable access to SRHR in Africa is through a steady shift in leadership on financing, procurement, and market stewardship, away from donors and towards countries themselves. CIF strategies and programs reflect this. We are determined to support a sustainable transition of financing to national sources, both public and private. For example, we're exploring a targeted SRH product partnership with the Global Financing Facility. We see this as an opportunity to increase sustainable financing, which is country-led for family planning commodities. Alongside financing, we also believe that the shortcomings in market data hamper access on a daily basis. In the absence of quality information on consumer demand, financing, and supply, policymakers are unable to plan effectively. Manufacturers are unable to make production decisions, and distributors cannot determine which markets to enter. The net effect of this is a reduction in market size, access, and availability that ultimately impacts those who are most in need. CIF is committed to transforming the situation, and SEMA, which my colleague Pape spoke about at the beginning of this session, is our flagship investment to carry this effort forward. Finally, we also agree that procurement tools available to national buyers, both public and private, need to be strengthened so that national buyers are able to access prices, quality, and reliability of supply that large global buyers such as UNFPA and USAID are able to get. I'm delighted to see the focus and the strong partnerships that the Galien Forum is providing. And I will stop here, keep to time, and pass on back to you, Rosebell. Thank you.
Thank you so much. Well done, Mrs. Chaudhry, in reminding us how we need to be shifting power towards equity, even in resource mobilization and resource capacity. Right now, I would like to turn to Christina. I would like to hear from you and how you and your peers navigate power, all these issues we are hearing from different speakers, issues of power and resources, and all these asymmetries that exist for you as a young person and as a young person from a particular country, understanding all these intersections that present themselves in your work, and how do we address those?
Yeah.
You're welcome.
Good day, everyone. Bonjour à tous. Mulibwanji nonse. Yes, just to dive in, because I think I have 3 minutes only. In terms of navigation around power and resources for young people, sadly, I believe we're not where we would like to be in terms of how are we engaged in the space. For a very long time, the advocacy has been, we should be in the space, nothing for us without us. There's been a lot of songs, a lot of advocacy initiatives that have gone into the work, but still, as a young person, you still find yourself in a space where you need to fight. There was a conversation we were having this morning, and the talk was, you cannot have power if you beg, right? And as young people, you find that you always have to fight to be in the space. You always have to either have linkages of someone who will bring you on board. So for example, you look at issues of who sits on the table. If, for young people, those are our entry points. Who are our allies, you know? And half the time, I think what I've found that has worked for us as an organization and also as a youth coalition under the GFF is keeping that conversation going with our allies. So you look at, okay, for example, you have the government. In our country, the director of planning is really crucial, and we work hand in hand with him. So there are certain conversations that are taking place that do not even involve young people, but because we've kept him in engagement and we involve him in what we're doing, then he brings us on board and we're up to date with the things that are running within the country. It's also a conversation of who is invited. half of the time, most of the initiatives that I have been engaged with, I was not invited, sadly. And I think that also shows, it tells a story of how young people are still an afterthought, you know? And also like how, in that case, then how do we identify priorities that affect young people? There was a lot of conversations I've heard from different colleagues. We're talking about teenage pregnancies. We're talking about taking girls back to school. You're talking about sexual reproductive health, which is centered on women and young girls. And there was a conversation, I think one of the speakers said, you need to invest in the girl from the early years, right? Moving all the way to when they become independent. But right now, you look at our youth spaces, and I think this is cutting across countries, you find that young people are not really supported. We are brought on board, we'll come, we'll speak at the meetings, we will be involved to a certain level, but in actual planning and programming, are we involved? And there've been instances where now you have, if the moment you say, I'm a young person in the space, everybody doesn't take you seriously. But I have to start the conversation with, I'm a public health specialist, I have done ABCD, and this is where I'm going. Already that shows the gap that we have in terms of how the behavior change that is needed on how young people are viewed. You know, we are the greatest resource. We are out there and ready to work. One of the, I think, key conversations I was having with one of the colleagues here was that most of the successes they've seen in the initiatives and projects we've been having around the GFF are initiatives by young people. You see, but those were initiatives that were like, okay, let's give young people a certain level of, you know, effort. And we do appreciate that effort. But from that success, can we build something upon it? Because that is literally telling us that we have a gold mine. And if we use young people, they'll be key in addressing issues that our communities are facing. Again, what am I saying? Provide space, agency, and resources. Because as young people, we are right there in the communities. We know what the communities are facing. I can give just quick 3 examples of an initiative that we've been doing with support from GFF. We managed to bring together young people from various districts, train them on budget tracking, but not only that, we equip them with skills to do public expenditure tracking. And from those initiatives, you'd find that now young people are able to engage in community scorecards. They're able to engage district health management teams, as well as directors of health and social services on issues that they're finding from the community. This is real live data. You see, so we are key in bringing out the issues that our communities are facing and help to address the health gaps that are there. We're able to track commodities.
I'm sorry, we'll come back, please.
Yeah, that's fine. Thank you.
Yeah, thank you. I'm sorry about that. Thank you so much. That was really, really powerful in terms of telling us. Yes, very, very powerful. Reminding us the power hierarchies that young people have to navigate to prove yourself. Yet it's your right to participate, and oftentimes there's these barriers that require you to prove yourself. Why do you need to be in this room? But also I hear you talking about linkages that you're making with different actors and being able to be at the table, but still reminding us that there's still a lot of talking about us without us, but even in circumstances where you're on the table, that talk is not backed by economic power, and there's no change with no economic power shifting. So thank you so much. Now I will turn to our 2 other panelists, Mr. Hayes and Mrs. Nying. Hearing from our previous speakers, I would like to hear from you how we can really rebalance among stakeholders to improve institutional capacities for countries to deliver services in a sustainable, efficient, and equitable manner. And I'll go first with you, Mr. Hayes. We've already had a bit of flowers from Christina talking about the GFF. We would like to hear from you, how are we rebalancing this power from your side? Thank you.
Thanks very much, Rosebell. In fact, I feel like I should just give my 3 minutes to Christine, because she was hitting all of the most important points. I am here from the Global Financing Facility, so I would be a bit remiss to not say that, certainly part of this challenge is a financing challenge. I think we've heard a lot about the dependence on external resources for financing SRH services and products. Another kind of often missed issue is that actually, if we look across low and lower middle income countries, the biggest source of financing is out-of-pocket spending from households. This is both incredibly inequitable and it's inefficient, and it is also partly what is holding back progress in this area. But certainly the donor dependence, and as Ravina indicated, I think we've seen that manifest over the past year, and that is still the risks associated with that are certainly something to be taken seriously. And just to connect this back to some of the things Christine was saying, is that when we look at how these systems are financed, we also know that the accountabilities for these health systems are often facing towards the external partners, looking back towards the donors, rather than the accountability being very clearly to the users. And you can tell that because we shift so much of the cost to households. There's clearly a breakdown in accountability. And I think just fixing the financing problem does not automatically create that accountability. I think we need to be clear about that. And the types of interventions that Christine is talking about around community engagement and scorecards and creating that facility level accountability is going to be incredibly important, but also how we measure success in our health systems. I think we have health information systems, and if you look at them, you will find lots of paper registers that are really good at counting health systems users, and they're really bad for helping to manage the care of patients and users of those health systems. And increasingly, I think we need a measurement paradigm that is not just caring about the kind of aggregate volume of users, but is also looking at the experience of those users in the health system, and that we are using that measurement around quality, that measurement around rights, that measurement that really focuses on what is the experience for women and girls using these health systems. We use that to hold our policymakers and our development partners and our international financial institutions accountable for the work that they are doing in our health systems. Thank you very much.
Thank you. Thank you so much. This is very, very important, especially capturing the idea of success, and oftentimes like whose success actually, and it matters who is looking at the success, whom do you ask when you talk about success. And as a person who is engaged often in collecting success stories for people, and the major question is usually, is the success today success tomorrow? How sustainable is this? Are you leaving anybody behind? How equitable is this? And reminding us like what success could look like depends on, the parameters, and reminding us to do better in that. Thank you, Mr. Hayes. Last but not least, we're coming to Ms. Nying, who is going to also share on the same about rebalancing the role of stakeholders in improving capacities of institutions in the country. Take the floor, Mrs. Nying. Thank you.
Thank you, Rosebell. Good afternoon, everyone. I think that I will echo a lot what Brandon just said. And so, but it will be from the implementing partner point of view, maybe. So let me share in a few points what we at MSI think could be done to achieve this important topic, how we can rebalance the roles of stakeholders to build institutional capacity and support countries to deliver. We are living in this continent where millions of girls will be reaching adolescence between now and the end of this decade. And it's a critical time to ensure that health and choice for women and girls are protected. And I'm really delighted to be part of this panel, this conversation with our critical partners here. So we are starting to see the benefits of close partnership between governments, donors, implementing partners, advocates, and community in increasing SRHR access across the continent. And these partnerships are accelerating access for those who need it the most in rural communities and among the most marginalized. So let me articulate my answer in a few points. First, we need to double down on those partnerships and close collaboration to keep momentum going. Through the headwinds of declining ODA, economic challenges, we went through the pandemic and it's still there. We also have resurgent anti-choice movements. So to double down on those partnerships, we need a sustained investment on SRHR, and it must be adequately funded within universal health coverage and the broader health agenda. So our experience shows us that when SRHR allocations are not ring-fenced in donor allocation or government budgets, they are deprioritized, and I hear that also from other colleagues here. They are deprioritized or reallocated elsewhere. And it's harder to hold donor government partners accountable. So we need to ensure that the GFF is supporting and aligned with FP 2030 country implementation plans and working with national governments and implementers to increase transparency and visibility over how funds are allocated, structured, and spent. B, we need to listen to rural communities, to underserved communities, to the providers and the community health workers who work with them and ensure that their perspectives are informing service provision. And C, we really need to remove the policy, the legal and clinical barriers in line with WHO guidance and the comprehensive definition of SRHR as defined by the Guttmacher-Lancet Commission, so that access is available, including abortion and contraception, to allow women and girls to make the choice that's right for them, that's right for the future. Second point, collaboration and partnership with governments led by the agenda of the government has been critical to ensuring SRHR access to communities that would have been left out. Similarly, we have the same collaboration that have been critical in opening advocacy spaces to advance SRHR discussion. We need to maintain that momentum. And we need to view all service providing institutions in the country, including non-governmental and private actors who have been serving communities for decades, as part of a country's institutional capacity, as they are part of the ecosystem of health institutions. And I think that such a view would give a very different starting point in discussing what needs to happen at the country level to ensure fully integrated SRHR services that are sustainable, effective, and equitable. 3, I'm almost done. I also want to emphasize that, and it will echo Brendan, you get what you measure. And impact is deeply linked to our focus on data and measurable results. And we should all strive towards that because it forces, indeed, accountability. So we need organizations, donors, partners to support and sponsor governments at high level, as well as supporting the delivery of real results at grassroots level. The two should join up. On a personal note, you will allow me, as an African woman, as a Senegalese woman, to touch on a key point as we are talking about improving institutional capacities for countries to deliver effectively and equitably. Since women and girls in West Africa will continue to seek abortion, whether or not it is legal, whether or not it is available, we must continue to strive to ensure that it is safe and treated it as it should be, a public health imperative and not subjected to stigma and unnecessary restriction. To conclude, putting resources in at global, national, and subnational level doesn't mean anything if it's not translating into real change. We see, as an implementing partner, we see huge and increasing demand for SRHR services in communities every day. And meeting that demand is one of the most cost-effective investments a donor or a government can make. And I will borrow the words of Dr. Dube, Director of FP 2030, what she told MSI recently when she visited. These are not hard to reach communities. It's SRHR services that are hard to reach. And we stand ready to continue to work together with all of you to change that. So thank you very much for your attention. And thank you.
Merci, thank you. Thank you so much. Those are powerful, powerful points. And just a little bit of wrap up, Ms. Nying reminded us that health and choice for women and girls must be protected, and that accountability for funders, government is also very critical, and transparency is important when we are talking about funds allocation, because without accountability and transparency, again, we cannot claim legitimacy in the populations we are trying to serve and reach. And lastly, she reminded us about the fact that our responses have to be rooted in lived experiences, whether they are criminalized or not, and that we have to respond to the needs of the people as their lived experience correlate with the responses. And also, she reminded us on the question of language, and as a communicator, I love language. So when you define someone as hard to reach, you've already taken away their power. You've already defined that, yeah, you have excused yourself to not reach them. So that is a very, very important point. How you define people in this work is very important. Thank you so much, Dr. Nye. We are wrapping up, and I wanted to come back because Dr. Dembele spoke first, and give her 1 minute to speak after hearing from all the speakers what the takeaway would be. Welcome, Dr. Dembele. Just 1 minute.
Oui, merci. Peut-être juste ajouter que quand on parle d'atteindre les communautés, il faut que, en tant que partenaire, gouvernement, bailleur, ces communautés soient des communautés les plus reculées possibles. Et nous oublions souvent, nous restons dans les grandes villes, mais le milieu rural constitue la plus grande partie des populations en général dans nos pays africains. Je voulais juste ajouter ça et remercier. Merci.
Thank you. Thank you so much. And lastly, to close the panel, I would like to hear a little more, 1 minute from Christina, because you were a bit on the roll. Just 1 minute to share your last thoughts.
Okay, thank you very much. I think for the rest of the results of what we've been doing, I can engage with whoever wants to find me outside. But I think in a nutshell of closing this, I would say the ask is great, but the resources are small. This is in terms of young people. You want us to be there, you want us to be engaged, but the funding, or rather the special attention that is needed to make that a reality, is something that I think we need to still discuss and converse and still have it as a standing item on the table until we address it. I think all in all, it's a good opportunity that we get to have and young people in the spaces. I think this is a great step, but like my colleagues have said, I think it's high time that resources are really focused on young people, and that we are given the space not only to engage, but we are your partners. So bring us on board. We have the skills. We bring on board a special attention of issues that are coming from a young people's perspective. So the issues of teenage pregnancy, all these things that you're talking about, if we're not on the table, you won't be able to understand exactly what that young girl in the village about my age is going through. So bring us on board, and we'll help you to take this initiative to the next level. Thank you.
Thank you. Thank you so much, Christina. And that is really hammering the point home because, you know, I come from Uganda. The average age in Uganda is 19 years old. So every time you're doing a decision in a position of power, remind yourself whom you're working for, because you're in the minority at the top with power, but the effect is on majority who are not at the table. Bring them up, but also remind yourself like who this is for. So thank you for a fabulous conversation to our great speakers. And we'll be moving next to our next panel, and a round of applause for our speakers because this was quite a marathon, you know, and they delivered very, very well. Thank you so much. We are going to our last session, just in case you are a bit feeling, you know, we are getting there. You know, keep up the fire, keep up the listening. We are going to our last session where we'll be looking forward, we're looking at proposed actions and solutions after hearing from all our speakers. Now is the time for us to hear some of the real actions that we can go with. In the next panel is going to be shortest. I'm going to be looking at the practical approaches to the challenges to HSRHR at national and regional levels. And to join me will be Sam Keliso Dube, Executive Director, FP 2020. You're welcome. And next on our stage will be Amos Mwale, who is the President, Zambia Center for Reproductive Health and Education. You're welcome, sir. And let's keep together. Let's keep together. And last but not least, we'll be joined by Arafat Kabugo, who is from Uganda, is the GFF Youth Representative. You're welcome to take your seat, Mr. Kabugo. Yes, and we'll keep the energy just in case it's the last panel. Even if it's the last panel, we are taking the energy still. And I would like to hear, you have 5 minutes because you're a small panel. And please, let's keep it tight because we have a very wonderful closing that will be also important to give time. So I would like to hear from Mr. Mwale. Coming from your country and from a civil society perspective, what would you see as concrete approaches needed to address SRH challenges identified by all the speakers we've had today? Quite what a challenge, but I'm sure you're up to it. So take the floor. Thank you.
Thank you so much, moderator, and bonsoir. Good afternoon, evening. So for me, I think it's a challenge for you to ask us to give solutions, especially after we've listened to what everyone else has said. However, let me try first and foremost to highlight a few things. The first thing I want to say is that as civil society, we need to start discussing and talking to each other. One of the things that I have noticed in the past few years I've worked in this sector, I think we are focusing more on delivering of programs, and we are not talking to each other. I think earlier on, one of the speakers mentioned that in West Africa, the civil society is quite weak. I don't agree. I think it's just the lack of coordination and talking to each other. We are busy competing for resource application. Where are we getting the resources? Who is sending an application? Is UNFPA funding who? I think that's the most challenging aspect that we are having. But if we can stop that and start focusing on how we can put all the resources together, talking to each other and trying to address all these challenges that we are hearing, then you'll be able to notice that we are actually working stronger together. I think that is the first concrete action point that we need to do. Like you've heard from everyone else, we need to start, we have seen that there's a lot of civil society shrinking space around when we are working. Our work has been difficult. Different governments are working, changing rules in terms of how civil society are actually engaged or how they are working with them. Honorable Minister from Senegal, we thank you so much for your support. we hope that you are working with our colleagues here in Senegal critically and giving them the opportunity to work with your office to complement all the things that government is doing. Civil society are there to complement government's efforts. We are there to speak on behalf of young people, on behalf of the vulnerable, so that they are able to be brought to the table. And not everyone else has the opportunity to interact with you, but we have the opportunity to interact with your staff, with your technocrats, to inform them what is currently happening. As civil society, we also need to get involved in the process of developing all commitments at country level. Once we do that, then we are able to bring in what the actual communities are saying. We've seen that there's been a number of commitments that have been developed. I think one of the key examples is with my sister here, the FP 2030 commitments. I think there's been a lot of consultation. How do we develop that in consultation with all the civil society? Once they are engaged, then you'll be able to see that they are part of the partnership and they are part of the country commitments that they are going to ensure that those commitments are actually delivered. They are not government commitments, but they are country commitment. So that's very, very important that the ownership itself is based on the country and not a particular sector, as much as government has a larger responsibility to ensure that they're implemented. We've also seen that currently there's been a process of developing the investment cases. How far are we gone as civil society? How are we engaging in that process? We need to get involved. We need to have all the consultation, because the RMNCH investment cases are hugely dependent on what the exercise that is done at country level and what feedback they are getting to ensure that we deliver the reduction of what we've had, maternal health, maternal mortality. Once that is done, then we'll be able to see that more of the service delivery will be actually focused on what people's needs are. So we earlier on also heard that we need a lot of political will. I think it's very, very critical. We need to start seeing that a lot of political will is actually adhered to. We need to start seeing that the ministers of health, our presidents are actually talking about these issues. Once there's that commitment, we'll be able to see to it that we are able to deliver what we have been promised. There's a number of discussions that have been going on with the ministries of finance. I think it's very critical. It's a discussion we have had earlier that the Ministry of Finance need to get involved in the aspect of ensuring that health is receiving adequate resources. It's not possible, we understand about the physical space, but as civil society, we need to ensure that what is budgeted is actually released, is sent to the district or to the province, so that the province also is able to utilize that resource. There's been a lot of, mismatch in terms of the budgeting and the actual resource that is released. You will find that when we put more pressure on colleagues who are working at district level or provincial level, when we just release half of the resources and we expect them to perform more miracles. So it is our role, like Christine was saying, to ensure that we help in that resource tracking so that we are able to give feedback to the Ministry of Finance on how difficult colleagues from the government, even from the departments of health, are not able to work with the resource that is going out there. They will not say it themselves.
Thank you.
But they need people to actually say it. And last but not least, we need to ensure that whatever we do at country level, there is one operational plan that we are following that is part of civil society and also part of the government. Thank you.
Thank you. Thank you so much, Mr. Mwale, for those great points, particularly on the shrinking space, civil society space that is affecting many across this continent, in reminding us the need to build a buy-in and to continue pushing for the right budgets for SRHR. Thank you. Now I will go to Ms. Dube. If you could please share with us on the regional level, how are governments and regional bodies and external development partners supporting the acceleration of universal access to quality reproductive health services, and what you see is the right moves, the right approaches? Thank you. You have 5 minutes.
Thank you very much for this opportunity. And with all protocol observed, it's great to be here, isn't it? We're trying to redefine the direction of travel for women's health in Africa. So my name is Samu Dube. I'm the executive director for FP 2030. What we do is that we galvanize political commitments for family planning globally. We used to work, and our target previously was 69 countries, but now with FP 2030, it's all countries. What this means for us is that not only is our mandate and narrative bigger, but what we have done since I joined last year is to decentralize how our approach is and have regional hubs throughout the globe, because you cannot operationalize this well. And because of these regional hubs, we are able to partner better with regional institutions like UNFPA at a regional level, WHO at a regional level, and many other bilateral and even country-based institutions to accelerate progress in terms of access to SRHR and family planning globally. That for us is shifting power. And power shifting is one of those elements that we need, painful as it is, we need for accelerating progress. It's painful, but that's the only thing that actually does accelerate progress. In terms of the structuring for family planning, SRHR progress, and where we need to all focus on, I've got 3 areas that matter. And the last area is about how we then measure this progress. The first one is around financing, and I'm glad that many speakers before me have articulated, number one, that we don't have enough money, and everyone knows that there's never enough money. But what I learned when I was doing finance is that money can always be found and money can always be multiplied. And there's innovation that can come around financing. But the issue is, how do we get that innovation? You can see me and here, Madam Speaker, we've innovated around how we wear our similar dresses. They look very different, but innovation, I think, is important. For example, we've spoken about, social impact bonds for family planning. We've spoken about how do we get economies to thrive so that there is that multiplier effect for women to actually access family planning. So, ladies and gentlemen, we've just released our report for family planning access globally. And one of the things that is fascinating for me is that over a third, and in some countries, 40% in Pakistan, for over 40% in Nigeria, close to 50% of women and young girls access their family planning services from private sector. That for me, you remember the previous panel, there was a discussion around governments being stewards rather than being operators of healthcare. And that is actually the reality. That's what is happening. We're not acknowledging it. So we need to somehow tap into that to accelerate progress. So for me, in terms of policies that need to matter, number one, we need to make sure we partner better with private sector, especially because they are already delivering services. We've been speaking about universal health coverage, largely because we know it's sort of an end goal. And I believe that if we don't granularize what SRHR means for universal health coverage, we may not achieve universal health coverage for SRHR globally. So we're talking about expanding the definition and refining it, but I also want us to go back and say, let's granularize what do we mean by this delivery service so that the prescribed minimum benefit, when we are accelerating universal health coverage, covers family planning for women, lest we lose that as we accelerate, universal health coverage. And also in the policy space, I would love us, and for all of us who are representing governments here, to invest more in the human resources for health, especially SRHR human resources, because it takes that doctor, that woman there, that nurse who actually delivers the service to understand how it ladders up to other aspects of sustainable development goals. Because when she's not paid, when she doesn't have the information, when she doesn't have the capacity, technical or otherwise, she will not deliver where it matters more. So we need to invest, and we heard this echoing around the room today. Lastly, ladies and gentlemen, I just want to point the issue of governance. So for me, governance is about stewardship. Governance is about doing what matters most. And one of the elephants in the room here, madam, is the issue of corruption in our countries. Dr. Amos, here you're in civil society. You're talking about budget tracking. We know from data that for some of the countries, only 10 cents per dollar invested actually reaches where it's supposed to reach. What are we going to do with that leakage that is happening in our society? Africa, we can do better than this. We can wake up and deliver something that is better, because the elephant for me is corruption that is bedeviling our society. Challenging this with what my grandmother said to all of us, the message is when we get back to our desks on Monday or Sunday or whenever you will, there is that document that you need to read and analyze and make different. There is that meeting that you need to go to and attend attentively. There is that conversation that you need to do, or even that email that you need to reply. But at times, we don't want to do it. That for me is part of why we are not achieving progress. So the leadership is between you and I, and what we do for women and girls when we get back to the office. Because my grandmother told me this one thing, if I may, in closing, she said that in the world, there are so many problems. And certainly when I walk in Africa, I travel across the continent, there are so many problems. She said to me, just choose one. And if necessary, defend it with your life. Otherwise, life is not worth living. And I want to challenge all of us to choose that one challenge. If you choose better, you're choosing for women and girls so that progress will be achieved. Brandon, you mentioned the issue of measuring what matters. I do hope that when we come back next time to this forum, we can measure how we've achieved more rights, more agency, more choice for women, because we've invested better, we've invested smarter in the way we do business in Africa. Thank you very much.
Thank you so much. That is power right there. That is power, and is not necessary to even repeat. So I'll go straight to our last speaker, Mr. Kabugo, and I'm glad there's also a young person on this panel to close our thoughts of the day. Would like to hear from you, because often, you know, young people are innovating and around all these barriers to access reproductive rights and health, but oftentimes there's kind of innovation stay on the side, you know, they take long to even be funded to recognize. So I would like to hear from you, what are the approaches you see in your work that are responding to these challenges that we need to be cognizant of, and any other thing you want to add on as you are the last speaker. You're welcome.
Thank you, Rosebell, and thank you to the audience. I would like to start with what the last speaker talked about. Choose one challenge and run with it. For us at NYHN, where I work, Naguru Youth Health Network, we choose to work with communities and to empower communities and young people to be at the forefront of changing policies, informing policies and programs. So what are some of these innovations we are doing? We are currently developing a community monitoring tool that we call the iReport. The iReport empowers young people to collect evidence at the communities and use that evidence to inform policies and programs that respond to their needs. I was giving an example in an earlier meeting today that we give an example where we had the COVID-19 outbreak, and the moderator will bear me witness. When this professor from Bara University discovered that COVID-19 drug, it was a scramble and petition for the drug, you know, and the communities were not accessing the vaccine. But did we understand why the communities were not accessing the vaccines, and they were scrambling and petitioning this COVID-19 drug that was locally made, and at a fee of 10,000 that was spiked to 50, 60,000, and yet the vaccine was free, you know? So how far do we go to make sure that we empower communities? We have communities respond or give us feedback on what programs we should design that should respond to their needs. In Uganda, we are talking about, you know, when we look at the 95 UN AIDS targets, we are failing so much on the third 95. And when you look at the young people that are adhering to their medicines, they're about 54%, and yet adults are about 74%. Have we gone further to understand why young people are not adhering? We are looking at low perception of condom use among young people. Do we further understand why these young people are not using condoms. That could be a driver to HIV, teenage pregnancies, and whatsoever. We have young people coming to facilities and saying, condoms have a bad scent, condoms irritate. But even first for the bad scent, how many of us in here would use a condom when it has a bad scent? Let me go back to the community monitoring tool, the ITIE report that we use. We went to one of the hospitals around Uganda and discovered that most of these health units or these health facilities have poor hygiene in the toilets. And then when we were disseminating this information, I asked one of the attendees, like I'm going to ask you in here, if you came to such a hotel, God forbid, and you went to the toilet and it was clogged, with, let me not say, how would you feel? Would you be free to come back at this hotel, or would you go back to use that toilet facility? And that is those are some of the conversations that we don't want to come up. So if we empower communities to tell us what is happening at community level, at the grassroots, maybe we can be able to tackle some of these challenges. One time we witnessed a mother die at an island because of obstructed labor, and she could not get an ambulance to cross her over the Lake Victoria to attend antenatal or labor at the nearest health facility across the mainland. How far do we go back to listen to the communities? So we have platforms, like I said, the ITIE report that informs some of these programs. We have at global level, we have the Global Youth Platform that taps into issues of young people from the grassroots, bringing such issues to the GFF, CSCG, and the IG to ensure that priorities of young people are taken into consideration. And I'm going to end with a note from Nelson Mandela and link it to putting communities at the forefront. He says that if we talk to a person in a language that he understands, it goes to his head. But when you talk to him in his language, it goes to his heart. How far are we talking to the communities in their languages? Thank you, and over.
Perfectly done. And reminding us community engagement, again, language, how we approach the people matters. But I'll come back last to Mr. Mwale to give us, having heard from both speakers, just what are the last takeaways from your practice in Zambia, the approaches that we need to be saying, this is working, we can go with it. Give us that one last shot, 1 minute.
Thank you so much. I just have one word for that. I think as Africans, we need to take leadership, and that leadership begins with us. So let's run with it. I think we'll make a difference. Thank you.
Lovely, lovely. And lastly, Ms. Dube, I will come to you and ask, because we talked a lot about shifting power, legitimacy, transparency, accountability all the day, all this afternoon. So I wanted to understand just a little bit in 1 minute in terms of how do we in reality shift this power, and how do we ensure accountability? Some of the things you've seen work during your work at FP 2020. Thank you.
I think shifting power is about trust. So trusting that, number one, I believe that governments do love their people at times more than we think we do. At times we think we love people more than the governments, but they do have somehow an intention. So we should trust that governments can actually lead as we shift power. Power cannot be shifted without money. So putting money where your mouth is very important. And I think whilst right now we need money from the, from the globe to actually come to where we want the power to shift and happen, we want our economies to do better so that power can truly shift. The previous speaker from the African Resources Center, from ARC, I think, spoke about manufacturing in Africa, doing this for our economies. When our GDPs start to rise, surely and truly will we say we have shifted power. When you put cash in a woman's hand, right, you have shifted her power. She becomes unstoppable. When a woman starts to put her money in her bra and decides what she's going to do with that money, surely that power is shifted. So all these variables that will add up to the woman having money in her bra, in her purse, in her handbag, that is power that is shifted. And we've seen that at FP 2030, as we shift countries to actually make decisions and lead, they actually start to have things happen, especially in terms of coverage for contraception where it matters.
Lovely. A round of applause to our lovely speakers. Excellent. Done. Reminding us money. And on that note, we know time is money, and we are happy to be almost within our program. You know, thank you so much for sharing with us, Ms. Dube, Mr. Mwale, and Mr. Kabogo. Please, you can take your seat. Thank you so much. And thank you to the audience. You've been really lovely, you know, in keeping up with a whole list of speakers who've been very brilliant, sharing information from all sides, you know. And we started very well with our co-host, our host, Minister, our SEC, who actually gave us great words. So we are also going to end on another good note with our other co-chair for the Lancet Commission on Future of Health and Economic Resilience in Africa, none other than Dr. Mohamed Pate. He's going to give us our last remarks. Welcome, Dr. Pate.
Thank you, Roswell, for an excellent moderation, and to all the panelists, I think, for a great discussion. You've given me one of the most difficult tasks in my little career, which is to summarize in 3 minutes a 2-hour discussion that is as rich as we have heard. I will try, but I'm not sure I will do justice to all the conversations that we have had. I have 10 points that I'll just go straight to, that I believe, in my view, capture the essence of what we've discussed. We heard that there's progress. There has been progress. UNFP, FP 2020, GFF, a lot of activity. But we also heard from the regional director of UNFPA that there's been no movement on the indicators. So we have to find a way to reconcile these two. If you look at my country, 5 decades, our population structure is fairly stable. Fertility rates still very high. And so for the future of the continent, if we say the continent is people, Africa is people, then we need to do some things differently to change that trajectory, to improve on the demographic dynamics, reduce dependency, and reap the demographic dividend. And we're still not there, even though there are lots of activities. So these 2 points, I think, came out very clearly. We also, the second point is, I think, was made about the disconnect between the duty bearers and the rights holders. I'm not going through my points in the sequence that they were made, but I think it's a very important point, this disconnect and the role of the civil society as interlocutors. It appears that there needs to be better, more systematic, sustained engagement of civil society actors who will arbitrate and fit programs and planning with the needs of communities. But the civil society itself needs to be better coordinated. We heard from Amos that that is a problem. They need to speak to each other, not to speak to only the donors or scrambling for little grants or there or compete among themselves, but look at themselves as part of a community, organize better. And I think GFF is trying to do that. The third point is really about the youth. I was struck by the point that youth, there's a gold mine in the youth of the continent. By 2050, Africa represents a significant chunk of the youth of the world. It is now and it will be. And that's a gold mine. And I don't think we've done well or as well as we should in terms of engaging them. Some of what has happened, let's say even on climate change, I think is attributable to some of that youth activism. But on this issue, I think we need to do better. That came out very clearly. And Christina was very eloquent. She said, provide us with space, with agency, and with resources. Don't just invite us as an afterthought. I thought that was very powerful. Then the fourth point is that this is a very complex issue, so we shouldn't oversimplify it. And it's also multidimensional in its nature, requiring multi-sectoral solutions. But at the center of it, Pape said political leadership is key. And this is a theme that many actors reaffirmed, that what we are seeing is a political choice. The leaders have chosen not to invest in this, and that's why we are where we are. And if they choose differently, we will be in a different position. So continuing to push on that political leadership is going to be key. And those who lead us have to shift in their mindset from operators to stewards. That's a very important point, where the stewards, sort of both the public, private sector, and I think that's a very good point that was made, and including ministers of finance, ministers of health. The fifth point is really about shifts. There are some important shifts that have to happen. It's shifting power to the woman, to the girl, to the adolescent. I think this was just made just now. I thought that was a very powerful message, to shift that power increasingly, not only global shifts, but also in the way we approach, empower the women to be able to make those choices. Shifts in financing from external to domestic, from out of pocket to more efficient ways of mobilizing resources. Innovations in terms of upscaling, the point about thinking about innovative way of financing like social impact bonds. Shifts in public-private, people's partnership, so that it's genuine, it's responsive, it's allowing us to deal with the headwinds that are ahead of us and to be sustainable. Shifts in mechanisms for purchasing, but to do that, taking into account the needs of the user and to defragment the approaches. So Faustin mentioned maybe sub-regional approaches. I think some more thinking will need to get into that complexity of organizing the mechanism of financing. Shifts in regulatory capacities to improve the regulations to be just adequate to guarantee quality, but also improve local ability of local manufacturing for those items. And to shift from sort of last mile, I'm just making this up, Faustin didn't say it, to the door of the consumer, to make it closer to the consumer and really do that. Shifts in accountability from donors, from facing outwardly to reporting to the donors, to also accountability to the users, and measuring that, and not only measuring the results, but also the quality of what is being offered, as well as the rights and how that is being done, and holding each side accountable. As well as on the accountability, the issue of corruption. It was at the very last minute that this was dropped, but it's a 1,000-pound gorilla in the room if you talk about governance on our continent, and we have to be able to speak on it and to see how that can be addressed. Then I think the sixth point I had is that there's a lot on the supply side. We need to do a lot more thinking on the demand side in terms of financing incentives, but also mobilizing actors. Data and digitization was also a key element, particularly to empower community health workers in the front line. Other things that we shouldn't forget, item 8 is, in my view, early marriage, teenage pregnancy, and safe abortion. Those are important elements that have to be considered, and in the context of where we are as a continent, but it's the continent speaking to itself. This cannot be imposed on the basis of values from outside. And number 9 in my list is the importance of community voices and the community users who are using the services, and ensuring they're reflected and their ownership, not only donors and governments, but also ensuring that and fits into the investment cases, how we plan. And that is the way to earn trust of the population on what we are offering. I think we also had about the issue of COVID vaccines. And then the final point is the importance of regional entities. That's the 10th point. We've got the FP 2030, UNFPA, WHO, we've got ARC, the Africa Resource Center. And I think they could be important vehicles for organizing on the continent to begin to shift the power balance. Because if your 54 countries and each negotiate with one donor, it limits your ability to really negotiate well. On the other hand, there is maybe an interim step where organizing within the continent, using platforms that exist and amongst them to set the agendas, to deliver, to build on each other's strengths, I think would be useful. So that's also part of shifting power. So this has been an extremely rich conversation, and I've tried to summarize. I know that my colleague Fatu has been writing notes on this. For the FIRA Commission, this is an important milestone for the working group led by Minister our COLL-SECK. We will summarize all of these insights. There will be a Lancet report in 2023, but it's not just about the report. Ours is a forward-looking effort that hopefully will lead to recommendation that will be actionable. And as part of the dialogue, this has been extraordinarily useful. So thank you very much for your participation, your contribution, and thanks to the GFF team, the Galien Forum team, our wonderful moderator, and all the panelists. So I will stop here. Thank you very much. Yeah.
What a wonderful end to a wonderful evening. Thank you, Dr. Pape. I'm here to say we are closing our roundtable, and you've been wonderful listeners, and thank you to our speakers. I would like to thank the Lancet Commission on the Future of Health and Economic Resilience for this roundtable on reproductive health in Africa. I would like to thank the Galien Forum for giving us this space, and our hosts, our partners, the Global Financing Facility, GFF, and all our speakers. Thank you, our interpreters, for keeping up with the pace. Sometimes we talk too fast, and I hope you've been able to catch everything that we shared this afternoon. Thank you for everybody who set up this room, whoever we don't know, whose work we have used, but we have not seen them. We recognize you, we recognize your labor, and we say thank you so much. And I leave here revigorated, knowing that we are going for sure to achieve universal health coverage, that we have a need in us to really see that universal access to sexual reproductive health services for all is achieved in our continent very soon. Thank you so much. And I'm so sure you have enough time to go out and enjoy Dakar. I live here a bit. It's a lovely city. So you still have enough time this evening to go and enjoy the hospitality of the Senegalese people. Last, I would like to announce that the closing ceremony is happening here in 10 minutes, I've been told. So you might have to stay back a little bit to listen to that. Thank you. It's been my pleasure, and I hope to see you somewhere next time. Merci beaucoup, and see you soon. Thanks.
Pour la 5e année consécutive, le Forum Galien Afrique se déroule en terre sénégalaise du 6 au 9 décembre 2022. Le Forum Galien Afrique offrira une plateforme d'échange exceptionnelle autour du thème « Accélérer la marche de l'Afrique vers la couverture sanitaire universelle ». Placé sous la présidence effective de son Excellence M. Macky Sall, Président de la République du Sénégal, le Forum Galien Afrique réunira des experts scientifiques des secteurs de la santé, de l'économie, de l'environnement, d'éminentes personnalités politiques et de la société civile, d'anciens récipiendaires de prix Nobel, des universitaires et des centaines d'étudiants en médecine et pharmacie, ainsi que des jeunes innovateurs. Cette 5e édition du Forum, avec 1500 participants, sera organisée en format présentiel et virtuel avec, du 6 au 9 décembre 2022, un forum des jeunes, un forum des femmes et un forum scientifique. Le vendredi 9 décembre 2022 se tiendra une cérémonie en présentiel au cours de laquelle, pour la seconde fois, le prix Galien Afrique, qui consacre la recherche, l'innovation, la santé et la technologie, sera décerné. Du 6 au 9 décembre, le Forum Galien Afrique fait de Dakar la capitale africaine de la santé, de l'innovation et de la recherche.